Hello friends, welcome to Local Mart Doctors. Our friends, today we came to Dr. Ankita Gupta. She is gastro and liver specialist, and it is located in GK Part 2. And friends, today doctor is with us. She is going to introduce herself, and she is going to share her experience and some services she is providing her. So let's start with Dr. Ankita.
Hello viewers, I am Dr. Ankita Gupta. I am a gastroenterologist and a hepatologist, that is a specialist in GI and liver diseases. So I am currently practicing at GLE clinics, South Delhi. So Gastro Liver Endoscopy clinics, it's a chain of clinic based out of South Delhi. So this GLEC concept is basically based upon providing a standard care for GI and liver patients, for various patients suffering from gastro and liver problems of pancreatic diseases, intestinal issues. So GLE clinics are basically standalone centers and a one-stop solution for all the gastro, liver, pancreatic, intestinal problems. So at GLEC, what we do here is we give solutions, we provide solution to all the gastro and liver related queries. So at GLEC, we as gastroenterologists provide care of excellence to patients coming from India and abroad. The main patients which we get at our center predominantly come from Middle East, they come from United Kingdom, patient coming from European countries, patient coming from Afghanistan, Kazakhstan, Tajikistan and all the neighboring countries. And of course we have a huge number of domestic patients coming from Delhi, NCR and patients coming from other parts of India. So at GLEC, we try our best to provide the excellence care in the field of gastroenterology. With the advances and the recent researches in gastroenterology, a lot of new equipment, lot of new techniques are coming which are provided at our center for the treatment of various disorders. The common disorders what we treat at our centers are starting from disorders in the food pipe, which is known as gastroesophageal reflux disease, when the patient has difficulty in swallowing and patient has something known as achalasia cardia. So endoscopic treatment of these disorders are also done along with medical care. Then all the gastro, that is the stomach related problem. So these problems include peptic ulcer disease, any tumor in the stomach, any polyp in the stomach, bleeding from the stomach, patients with liver disorders like liver cirrhosis because of consumption of alcohol, hepatitis A, B, C, D and permanent liver cirrhosis because of different etiologies. Patients coming with bleeding from the stomach, bleeding from the food pipe, they are also treated at our center. It is a daycare center where we do not admit patients for more than 24 hours. So a quick turnover is our aim. Quick, efficient treatment is delivered to all the patients coming from all across the world for all the GI, liver and pancreatic disorders. Another domain what we deal with here is the management of obesity. Practically weight management is highly required these days as a lot of other diseases come with obesity. So other than the standard diet management, lifestyle modification, we also provide world-class treatment based out of endoscopic use. So we use lot of endoscopic silicone balloons to reduce the gastric volume and to give a significant weight loss and inch loss without undergoing any surgeries. So the other domain what we deal with here is the management of weight. Weight management and obesity, as we know, is the most common and deadliest problem these days the entire world is facing. And obesity is not just a cosmetic problem, it's a disease as it also leads to lot of other health issues. So weight management is entirely important. Other than the standard care, the standard practice, including lifestyle modification and dietary changes, we also provide solution in form of endoscopic weight management. We use a lot of intragastric silicone balloons which are placed endoscopically inside the stomach, and the stomach volume gets reduced and weight management becomes easier, quicker and hassle-free. We also provide bariatric surgeries and all sort of bariatric procedures based on different patients' profile for the management of obesity. So that is all about Gastro Liver Endoscopy Center. It is dealing with all the GI liver issues and also deal with weight management. So the other important disease or other important aspect of the treatment given at our center is screening and surveillance. Today we know that we all are seeing a lot of malignancies and cancer patients in our neighborhood, family, relatives and friends. So risk of cancers are on the rise for all of us. So we here provide care of excellence in screening early tumors of the entire GI system, starting from food pipe to stomach to intestines to large intestine, that is colon, liver cancers, pancreatic cancers. So we here provide world class technologies to diagnose or detect early tumors in the high risk population, or even as surveillance in normal population, to prevent the risk of malignancies in future. We have the latest advanced endoscopic technologies. With the help of those instruments, we help in diagnosing tumors at an early stage. They are easily picked up and they are easily managed at a much earlier age, rather than dealing with stage 3, stage 4 diseases. So the risk of malignancies can be minimized if at our center patients are coming for screening and surveillance for themselves or for their families and friends.
So, ma'am, can you please let us know from where you started your journey, and today you are like very famous doctor in this local area, and your patients are trusting you. So, how all these things has been happened, and what kind of challenges you face to reach on this level? So, please share where you started your journey, what kind of study you have been done, and how you reach here.
So as we know that as far as gastroenterology is concerned, it's a very fascinating and largely increasing number of diseases and ailments are affecting all of us because of change in lifestyle and the eating patterns especially. So when I was preparing for my pre-medical tests, so I was always fascinated by all the gastric issues when I was studying in my 12th standard. So I cleared my PMT exam and got into MBBS in Christian Medical College, Ludhiana, one of the premier institutes in the country, where I did my graduation. I had completed my MBBS in 2006, and then I proceeded to do my MD, that is Masters in MD Medicine, from the same college, my alma mater, just Christian Medical College, Ludhiana. Then I did house jobs in medicines, and I've also worked in the rural areas of Punjab. I served in Bathinda and the adjoining areas as an assistant professor when I was working in a medical college. I worked for rural population, patients coming from small villages, small towns, and not much access was there to those patients to get rid of a lot of diseases, especially GI diseases. When it comes to Punjab, a certain Malwa belt, we see the researchers also, we see a lot of gastro-related tumors and cancers, and that's what made me intrigued. And I went on to decide that I will take up gastroenterology as my super specialization, and then I appeared for my super specialization entrance exams, and I got into DM program in prestigious DMC hospital, that is Dayanand Medical College and Hospital, situated again in Ludhiana. So under the guidance of my eminent professors, I could complete my super specialization in Punjab, and I served people of Punjab in the rural areas, and then I came back to my hometown, that is in Delhi. So there I joined Sir Gangaram Hospital to take advanced trainings and learnings in the field of advanced endoscopies and the latest technologies. And by God's grace, I got selected for another program, prestigious institute in the United States of America. So I went to the Medical College of Georgia to complete my training into neurogastroenterology and motility disorders. As a common people, we can understand that a lot of patients suffer from chronic constipation, diarrhea, and they use a lot of medicines to get rid of the problem for their lifetime. So this is all neurogastroenterology is all about. So I went there and completed my training, and then I came back to serve my people here, and that's where we are. So I started with a small center in Delhi, and I was working with various hospitals, and gradually by God's grace and everybody else's blessings, the patients were getting benefited, and we could manage to get a bigger center. And now we are in the process of opening the chains of various standalone gastro liver endoscopy centers across Delhi NCR, and hopefully we'll be able to serve you in the coming time even in a better way.
So thanks, ma'am. You given us your like wonderful time and fruitful information. So definitely it is going to help to our users, our audience who's seeing you, and they're getting some information. They will come here and definitely take your services. So really, thanks for your wonderful time.
So thank you, team. So it's a good awareness program that you guys are doing. So that is for the general masses, and I hope we all bring more awareness to our population and give the excellent treatment to all the users. So my good wishes to the entire team. Thank you.